The city has announced plans to spend millions on an effort intended to better handle 911 calls involving the mentally ill. New York 1's Angie Gonzalez has learned that some of those who made recommendations for the proposal think the plan misses the mark. She joins us now with the latest.
That's right, Anthony. Yeah, that's right, Anthony. And police interactions with the mentally ill is something that authorities have tried to address in the past with, amongst other things, police training. But in this case, this was supposed to be a collaborative effort with a number of advocacy groups, as well as the mayor's office and city council, to work on a proposal that they could come to an agreement on. But those we spoke with say that they're not on the same page. The mayor's office and city council made a joint announcement Monday. This year, the city will invest $37 million towards services for the mentally ill. $23 million of that will go toward adding personnel who respond to 911 calls involving the mentally ill. Advocates say the goal is preventing deadly interactions with the NYPD.
We got the mayor to bring back a task force in 2018 on the Crisis Prevention and Response Task Force that was supposed to look at not only how to respond to these crisis calls, but how to prevent them in the first place.
According to the mayor's office, the task force helped develop many of the strategies that will be implemented. Among them, the addition of several response teams that will include various combinations of clinicians, caseworkers, police officers, and everyday citizens who've experienced a mental health challenge. The city says it's the first time mental health professionals will be part of the city's response to 911 calls. Some who've been advocating for change say the proposal is missing a key component.
He focused on items that were old items, old thoughts, old news. He focused on co-response teams, that's police and social workers going to crisis calls. But our problem is this: we don't want the police involved.
Anthony Posada of the Legal Aid Society echoed this concern, saying we must further expand the non-law enforcement responses to calls for help and move away from relying on police intervention when what is needed are the services of trained mental health experts. Dr. Darren Porcher, a retired NYPD lieutenant who once worked as a police academy instructor, says he's skeptical the plan will work.
It's like putting a Band-Aid on a dam, so to speak. So we need a more comprehensive solution as opposed to just throwing money to the wind and applying it to the NYPD.
Another component of the mayor's proposal would change how the NYPD refers to such calls. Currently, they're referred to as EDP, emotionally disturbed person calls. The proposal seeks to reclassify them as mental health calls. An NYPD spokesperson told New York 1 there are a number of proposals, including terminology, that we are taking under review. And despite those words from advocates, Anthony, asking for the changes to be made to the proposal made by the mayor's office as well as the city council, the mayor's office says that these new rules are being implemented immediately. In front of One Police Plaza, Angie Gonzalez, New York 1. Anthony, back to you.
Angie, thanks.